So regarding nursing leadership, to me, what that really means is being able to be a strong advocate for patients, and to look out for opportunities that improvement and change can happen within the hospital and within the unit that we're a part of. One of my previous managers, actually the one right before the one that we have now, was awesome, and he made it a point to emphasize working to the full extent of the scope of our practice. So, and that's something that was reinforced by reading I think it was the first chapter, chapter 1, Greer, where they were discussing the Future of Nursing report. And so one of the recommendations in that is that nurses work to the full extent of their license and scope of practice. And he was very big on that. One of the things that he instituted before he left, a few months before he left, was using a set of complaint-based protocols. So like I said, I work in the ER, and triage is a big part of that. And so one of the things that he had us do was go through training and set up a series of nurse-initiated order sets that you could click on and then implement from triage. And so these were order sets developed in conjunction with nursing leadership and the ER physicians and, various other parties to sort of come together and help us, give treatment to patients faster and a safer way that reduce some of the burden on the docs and helped reduce overcrowding. And that was really instrumental in changing the department, the way that we function and the way that we brought care to our patients. So that allowed us to work more within the scope of our practice and gave us a little more, it gave us more autonomy, but it also helped increase and improve critical thinking skills as far as, when folks come in, their chief complaint isn't always chest pain or abdominal pain. It might be, I've had this sort of, I don't hurt, but I've had this sort of tightness, like right here, things like that can be a little more open to interpretation. And so that sort of helps improve our critical thinking skills, especially out in triage, but in a way that is guided by evidence and by best medical practices through these set of protocols developed by our ER physicians and the leadership. So that was a really awesome development. And I think in a way that really helps with the leadership aspect of nursing, because then we're able to direct the other ancillary care units to help implement those orders as well. Leadership and, let's see, one other question to address. How did meaning change or stay the same with module content? I think that reading that sort of review of leadership and the Institute of Medicine report especially helped to sort of reinforce that and help me see. It really made me see where my previous boss was coming from. I mean, that makes more sense to me now. He would always talk about work within the full scope of your practice, and that was a huge point for him. And now that makes more sense to me as to where he was coming from with that. The next question to address: describe leadership behavior as observed in myself and colleagues. Could a behavior be modified to create a more effective leadership strategy? Teaching is a big one here. Leadership isn't necessarily always easy, depending on the folks that you're working with and the patients that you have, and even the kind of, day you're having or the stuff that's going on in your own life can make it hard to sort of step up and be that confident person all the time. But even in smaller ways, I mean, leadership is huge. So like I said, teaching is a big part of ER nursing, and in every part of nursing, I would say, but we really have a pretty big responsibility as far as discharge and follow-up goes, especially for the folks who are being discharged to self-care. That's a big part of it, and it's something that I'm constantly working on and trying to get better at. So could behavior be modified to create a more effective leadership strategy? Yeah, I mean, when I'm thinking about, in particular, the teaching aspect of it, that's something that I think a lot about. One example is we have a fairly large population of IV drug users here in Southern Oregon. And one of the things I try to do is really do effective teaching regarding prevention and harm reduction is a big one. So I'm currently looking at that in my ER as far as needle exchange programs in a city at just a few miles from here. They have those now. So directing people to those resources, talking about STI testing and needle exchange, safe practice there, getting a primary care doctor, just general areas of harm reduction. So I mean that's something that I'm trying to make more accessible to other nurses too, so that they're able to institute that into their practice as well. I think that would be really effective as far as bolstering nursing leadership and bringing change to our patients. So, thank you.